Good morning, Mikal, and welcome. We'd like to thank you so much for being willing to share your CHW story and to be featured on our CHW Center stage. All right, so welcome.
Thank you for having me, and I'm excited to be here.
Okay, good, good. So we're going to jump right in because I'm excited to hear all the things about your journey. Tell us, who are you?
I'm Mikal Lewis. I'm a United States Army veteran. I'm also the Associate Director for the Bold Public Health Center of Excellence on Dementia Risk Reduction with the Alzheimer's Association. And I'm also a certified community health worker in the state of Texas.
Nice. All right. So what is it that you do?
Um, every day I'm managing daily grant activities for the center for short. I collaborate with scientific partners nationwide to turn evidence into public health action and tools. And so, what I really do in simple terms is I develop a lot of resources for state, local, territorial, and tribal public health agencies just across the nation. And then I also see the dissemination and the capacity building around these resources.
All right. So tell us, why does what you do matter?
That's a great question. And thank you for asking. I'm dedicated. I'm very dedicated just in improving health equity, community health, the social determinants of health, and also advocating for underserved and diverse populations as well.
Mm. Okay. Oh, so tell us, Michael, what influenced you and how did you become a community health worker?
Ooh, I haven't thought about this one in a while. So I want to say many, many years ago, I was already doing the work as a community health worker for about
Mhm.
3 years. And in my role at United Way of the Brazos Valley at the time, I was actually overseeing 7 counties as well as the 211 Texas database, helping the community as well as those who are underserved in the population just identify those resources for rent, utilities, housing, transportation assistance, and really just wanting to give back to my community.
Mm. Okay. That is absolutely amazing. So tell us, what is your CHW story?
Thank you. So I'll try not to get too choked up about this, but in 2017, Hurricane Harvey hit Texas. I was working at the 211 Texas call center at that time, answering calls from people in crisis. So many were stranded, many were scared, as well as unsure of where to turn or where to go in their evacuation process or just seeking to be rescued. And at that time, the building that I was in was also flooding. So I was on the outskirts of Houston. But despite all of that chaos surrounding me, as well as my colleagues, one call after another, I stayed on the line, just connecting people to those emergency resources. So I would like to say just being a lifeline in that moment while experiencing the emergency myself was a turning point. And that's what really prompted me to not only seek a formal training, but a formal certification. And that's where I sought after the community health worker certification in the state of Texas. I know.
Thank you. Yes, yes. I mean, I just want to take a moment. What a story, right? And we appreciate you for sharing that with us. It really speaks to your resilience, right? And then taking that right, and now the impact that you're making, that you made then and ongoing. So thank you so much, Mikal, for sharing that tender moment with each of us. Um, oh, let me gather myself.
I know. I'm sorry.
No, no apologies. No, we welcome it. We welcome all of that. That's what encompasses us as community health workers. So I appreciate you sharing it. So I have one additional question. If you had one gem, one nugget to share with aspiring community health workers, what would that be?
Do not allow anyone to put you in a box. I have so much experience as a community health worker from nonprofit management to emergency preparedness to environmental and policy change. And now I'm currently in the dementia and Alzheimer's space. So you do not have to focus on one niche or one area of focus. You can expand as much as you would like to in the public health, medical, or the governmental space.
I absolutely love it. Thank you. What a gem. And you heard it here from Mikal. Thank you so much, Mikal, for sharing your CHW story with us. I look forward to staying connected. We wish you the best.
Thank you, Sarita, and I appreciate it.